All right, so let's talk about clinical applications then. So we've got a bit of a laundry list here of various things that ultrasound is used for. But the first major point is that there's just limited evidence to support most of these usage, but that's mainly due to poor research design and variations in dosage that were used. So it's very hard to compare. It's not a apples to apples. It's kind of an apples to oranges as you look across what people have done over the years. Okay, one major exception to that is fracture healing, which is why I have the double star there. And so we'll look at that as we go along. Okay, so the first one that we'll look at is just soft tissue shortening. And as we looked at in just the previous slides, is that ultrasound very effective for heating things with collagen in them. So capsule, tendon, ligament, very good. Just got to make sure we're getting it up hot enough and that we're getting that 3 to 4 degree C centigrade temperature rise. Parameters are listed there below, and as shown in the picture there, it's recommended that we stretch while heating, mainly because of the short window, which we'll look at here in just a minute. Okay, so let's look at a little bit of the literature. Draper's a name that you're going to see over and over again anytime you start to do any PubMed search on ultrasound. So here we have that same article that we looked at earlier in the table, but we're looking at in the chart here. We're looking at what they found for the rate of increase for both 1 and 3 megahertz at various power settings: half, 1, 1.5, and 2. And so you can get just some idea of how quickly the temperature is going to increase. And a couple of things to note is one is just how quick the temperature comes up looking at your 3 megahertz. At 1 watt, which is close to where you're going to be using it, 0.8 to 1 watt per square centimeter, about a half a degree per minute. And out at 2, it's 1.4, and that's pretty rigorous. I mean, people are not going to tolerate that. So our typical range for 1 megahertz is there at 1.5. So you get about 0.33 degrees C per minute, and the 3 megahertz, the one to note is that they're at 1. Okay, so that's how long it takes to heat things up. But the flip side of this is how long does it take to cool off? Because that's what we're talking about here, is heating something up and doing some stretch to it. And so, doing some mobilization. So the thing that you need to keep in mind is you've got a narrow window. How quickly are things cooling down? And so here again, Draper looked at the rate of decay with 3 megahertz and found that you're dropping below that 3 to 4 degree temperature rise at a little over 3 minutes. So you got about a 3 to 4 minute window in there if you've heated it properly to start with. That was with 3 megahertz. And then they also did the same thing with 1 megahertz, and you get a little bit longer window. And because the deeper structures is going to take a bit longer to cool, so you get more like 7 minutes with that, so a little bit more time. But something definitely to keep in mind, if you're doing an ultrasound, plan on doing a joint mobilization or doing some stretching, you've got to be on it. You can't let it sit and then go and expect that you're going to have any effect from your ultrasound. Okay, so these are critical issues when it comes to are we going to have an effect with our ultrasound or not, that you need to be aware of and on top of. Okay, and so another study here where again Draper and just a case series here, but they just looked at ultrasound and joint mobs, and were pretty successful there. Normal activity, normal use of their hands, and this was just looking at doing joint mobs after doing ultrasound to the hands. So just to give you some idea and another reference to look at. All right, so another clinical application is just for pain control. And so various ideas of why we control pain with this, but probably stimulating thermal receptors, possibly the effects that we have on inflammation, because again, no matter whether we're running pulsed or thermal, you're going to get those quote non-thermal effects. And the parameters that you're going to use for pain control are listed there below. Any kind of power setting, any kind of megahertz frequency, either 1 or 3, and time frame in that 3 to 10 sort of minute range. Okay, and again, not not a whole lot of literature in support of this, and we're probably doing other things. You know, we're probably affecting some of the inflammation, or increasing the tissue extensibility, causing pain control, rather than just a true pain relieving function of the ultrasound. Okay, it's also been used for ulcers, and and here is where animal studies have been in strong support of the healing effect of ultrasound, but our human studies have not panned out as well. And so the general guidelines for using this for wound healing are using the pulsed sort of protocol here, 20% duty cycle, 8 to 10 or 0.8 to 1.0 watt per square centimeter, using 3 megahertz. Okay, treating the wound perimeter using either a coupling sheet. You can possibly place if it's a foot or ankle, something like that, placing it in water and using it like that, but usually treating the wound perimeter for that. And so, if we go and look a little bit at PubMed, here's a Cochrane database systematic review from 2006. And here, this is in regards to ultrasound for pressure ulcers, and they found there's no evidence. And but again, they also point out that that we can't rule it out because small number trial, method problems, small numbers, so further research. So as I indicated initial on. Okay, same guys, different journal though, looking at actually, I'm going to skip down one more slide because I was expecting this one next. Pressure sores, same guys. Okay, so another Cochrane database review from a few years earlier. No apparent evidence of benefit of ultrasound in the treatment of pressure sores. Okay, and let's pop back to the other one here. And this was just reviewing, looking at various things for wound management. They looked at beds, they looked at compression, laser therapy, therapeutic ultrasound, and again, generally insufficient reliable evidence about therapeutic ultrasound. Okay, so wound care, definitely the jury's out. Need more research here for using this for wounds. Okay, so moving forward here, another one here, same set of guys, venous leg ulcers, no good evidence. Okay, so you're getting the idea. All right, so now, but that brings up another fairly recent use of ultrasound. And you can go to this website, celleration.com, and I think they've got some videos there that you can look at too. But it's called mist therapy, and this is very low level ultrasound, kilohertz instead of megahertz, combined with a saline mist. And so there have been numerous trials that have shown some pretty good results with this, and probably due not just to the ultrasound, but also to the gentle debridement that they're getting from the mist therapy. So something to take a look at, keep your eyes open for, especially if you're getting into the wound care realm. Okay, so then looking at surgical incisions, another clinical application. And so here, though, we seem to show some benefit. Kind of weird, that we're not seeing it for some of the other kind of wounds, but those are wounds that are problematic sort of wounds. Here we got a surgical incision that should be healing anyway. But parameters here, 0.5 to 0.8. Looking at different frequencies, either very, very low at 0.75 or 3 megahertz is what's been described in the literature, and using that pulsed or non-thermal sort of mode, using it 3 to 5 times a week. And so kind of the thought here is, and again, here's where we have some of the animal models that show pretty good support. And these guys, Young and Dyson, looked on the effect of ultrasound on angiogenesis, and they were looking at rats, and they found that they had a lot more blood vessels after 5 days, but things got to be pretty much equivalent by 7 days. So they were seeing some effects on angiogenesis. And then these guys looked at, again, an animal study, looked at tensile strength, collagen, reduction in wound size, mast cell degranulation, that they saw a significant effect in where they used their ultrasound. So enhancing strength, like it says there, 24%, collagen 29%. So pretty good results there, again, in the animal models. And then there's some a little bit older things. What are those? Like 40 years old. Looking here in physiotherapy, back in '81 with episiotomy. So looking at scars. And so number of studies, if you go and search this, looking at pain reduction and scar reduction and hematoma after episiotomy. So so some pretty positive results in some studies from back then. Okay, so that brings us up then to another application, tendon ligament injuries. We'll kind of look at three things: tendon inflammation, our itises and our tendon healing after surgical repair, and then ligamentous injury. Okay, so research appears to support early use of ultrasound for after rupture and repair, but again, there's still limited studies here, and so a lot of these are animal studies. Parameters are shown there below, and the main point: low intensity is recommended to avoid heating acutely inflamed tissue post-operatively. So even though this is so one thing to note here is that this is they're recommending continuous, but notice the duration is very, very short, and also you want to avoid heating something so you're not increasing the inflammatory reaction. Okay, so looking at tendon inflammation, then very plus minus on things for things such as epicondylitis, calcific tendonitis, things like that. But again, study quality has been poor. You want to avoid heating here, so we're going to be using pulse settings. So anytime we've got something inflamed, you've got to be real careful about inducing, putting heat into that. So a little common sense there in what you're going to use. But then with chronic sorts of problems, you probably want to turn that around and go ahead and use heat, because you're going to assist with stretching and affecting collagen, but kind of more along the lines of what we talked about in the very first application. So rather than directly dealing with the inflammation. So not good evidence here for the inflammation. And then looking at ligaments, again, animal models mainly here, showing some increased type 1 collagen formation, but not a lot of good evidence looking at this for humans. Okay, but the recommendation for usage where it has been studied, again, low dose pulsed. Okay, keep the heat out of that one. Okay, so another thing that you'll see is using this for resorption of calcium deposits. Very little literature here, and mechanism is totally unknown. We look back in this New England Journal of Medicine study, 1999, ultrasound for shoulder, because that's where you'll see this a lot, is people trying to use this for resorption of calcium deposits. They noted, as shown there, it seems to help resolve the calcifications and short-term clinical improvement. And we're probably seeing a reduction by decreasing more of the inflammation, increasing range of motion with stretching, rather than actual resorption of the calcium deposit. Now, there's no real known mechanism for why this would change the calcium deposit there. So just keep that in mind. Very small amount of studies there. Probably not something to be doing in the clinic. Okay, so, and it brings us up then to another application, and that would be fracture healing. So current research, very positive for this, but it's using a very, very low dose here. So we look at 0.15 watts per square centimeter at a pulse duty cycle, and using this for 20 or so minutes a day. It's received FDA approval as a device. This is typically done with a special device, not your clinical applicator. Many carriers are have started to cover this, and I did do another review this year for this to see who else was covering it, but you can see Blue Cross Blue Shield, Regents, and so you can take a look at that and see who is covering it. But CMS is covering it, or Medicare when I say CMS, and usually the insurance companies kind of fall in line with that after time. All right, so fracture healing, so that's a good one. So it brings up phonophoresis. So this is basically analogous to iontophoresis. All right. So this is pushing drug through the skin by using the ultrasound energy. We're using ultrasound mixed with some sort of topical drug as the conduction medium. And the idea here is that we're increasing permeability of the stratum corneum, and recommended parameters are listed there. But Cameron in 1992 showed that the common media that was mixed using for phonophoresis was totally blocking the ultrasound waves, which negated many studies that had been done in previous years. So rather interesting. So they had been doing this and showing some effects, but she looked at just what would transmit the ultrasound energy, and these totally blocked it. So rather interesting. Okay, so the things that will allow some transmission are listed there below. Lidex Therapeutic cream allowing about 80% transmission, so getting some of that energy through. Okay, so research seems to support the use of ultrasound for transdermal drug penetration, but you've got to make sure that you've got it mixed with something that will transmit the ultrasound energy. And so if you do a little PubMed search on this, there's lots of work going on with ultrasound and drug penetration. So we'll probably see some resurgence of this again as well in the coming years. All right, so looking at some contraindications, again, think about things, what don't we want to heat up? So some of these are fairly, should be obvious, but, over tumors, active bleeding, infection, electronic device. One, we don't want to possibly heat the device up, depending on what's made out of, but also just the possibility of affecting it. So, we wouldn't want to be doing this over in the region of a pacemaker. Doesn't mean we can't do this with someone who is wearing a pacemaker, though. Okay, so someone who's pregnant, again, over the critical regions, pelvic, abdominal, lumbar regions, somewhere where the ultrasound may affect the fetus. You're going to want to stay away from that. Over the eyes, over the testes, okay, reproductive organs, over a DVT or thrombophlebitis. You might break that clot loose, okay, so CNS tissue. So, I pose where that would be a problem, where do you think this might be a problem? And so think about that a little bit. But, because we don't have too much CNS tissue that is exposed, and that would be the clue there. So think about that, and we can talk about that a little bit in class. Okay, and the last one. Okay, here we go. Total joints. Okay, so the last part of that sentence I put in there, that metal is okay. Okay, so putting ultrasound over metal implants is just fine because the metal doesn't have a high absorption coefficient. As a matter of fact, it reflects most of that energy. And so this is a very, very common misconception about ultrasounds, that we can't do it over metal. Well, we can. Okay, so we can. So just keep that in your mind. The problem comes in with doing it over more recent sorts of prosthesis are using more plastic and using more and more cement. All right, so on one hand, we probably don't get anywhere near the temperature increase at the depth, let's say, of a total hip that you're going to affect this joint cement. But people have done studies where they've used ultrasound and heated things up to where they were able to, make some of the cement come loose and melt some of the plastic components. Well, that wasn't in a live subject, okay? So and not with a clinical stimulator as well. So while ultrasound could affect these things, very, very doubtful you're going to affect them at a deep level. So, but just something to keep in mind as you go through. So, listed as a contraindication because obviously if something comes loose and you've done ultrasound over it, you're the one that's going to get the blame for it. So, err on the side of caution when it comes to over any kind of joint cement plastic components. Okay, so precautions. Acute inflammation. It's a precaution because you don't want to heat things up, but if you're using pulse mode, you're probably okay with that. Precaution over fractures. Okay, so maybe a little conflicting from what we just said. It's good for fracture, but the key is that you use the right parameters for it. Okay, so it had been a contraindication for many years because if you take ultrasound, it's kind of the poor man's bone scan, kind of like using a tuning fork. You'll see people use this in clinic to see if someone has a stress fracture. Not a very good, no very good statistics for using that. The psychometrics are pretty bad, but you'll see it done in a lot of sports environments, athletic training clinics, running a ultrasound head over someone's tibia, looking to see if they get a reaction. Because if there's a fracture site there and you turn that up nice and high, you'll get a nice pain response, or can get a nice pain response out of that. So fracture, not a contraindication. You're going to get a pain response. On very low settings, we're going to get some healing. Okay, so been shown to explode breast implants, so we'll stay away from that. And then epiphyseal plates. Okay, here again, controversial research. We're probably not affecting epiphyseal plates, but again, this is something. So obviously, this is in children whose plates have not fused. That's what we're talking about here. But research is very plus minus on this, but definitely err on the side of caution. Don't apply it over the growing plates. That would be your best advice there. So adverse effects. The nice thing is not too many adverse effects. The most common thing that's going to happen here is a burn. If you mind proper application technique and keep that sound head moving, you're going to avoid that. If you're not doing it over insensate areas, someone's going to tell you when it gets hot, so you shouldn't have too much of a problem there. And make sure that you're reducing intensity when you're over superficial bone, or where someone has circulation impairments. Okay, so again, the other thing that can happen is you can get blood cell stasis because of things called standing waves, and you can damage the endothelial lining, and that can happen very, very quickly. It's just pausing a treatment, and just talking to someone else. And holding that sound head steady. So the key here again is keep that sound head moving. Okay, and then another thing that comes up, and this is something to bring into the clinics as you go, because this isn't done very often, and that's cleaning those transducer heads after every use. Okay, so making sure that those are getting wiped down with some sort of antimicrobial wipe, to prevent cross-contamination or infection. All right, and so let's talk application techniques then. All right, so I keep using this slide because it pretty much tells you everything you need about application of ultrasound. So if we go through this a little bit and look at each side of the chart here, that we see if we're looking at soft tissue shortening and we want to get a thermal effect, our duty cycle is going to be 100. If our depth is shallow, we're using 3. If our depth is deeper but less than 5 centimeters, we're using 1. And our intensity is listed there. I would add 0.5 to about 0.8 for the 3 megahertz, and that's a pretty good intensity setting for the 1 megahertz. Duration of treatment is going to be 5 to 10 minutes, and this isn't actually divided by 2 times ERA, but it's per twice the ERA. We'll look at area in the next slide right here. And then if you want a non-thermal effect, you're going to put that on your pulse setting. Depending on your depth, you're selecting your 3 or you're selecting your 1, and then you're setting again 0.5 to about 1. All right, so let's talk about area then that we're applying this. And this isn't looking at area is extremely problematic as you look at some of those articles, and this was, I think, one of the reasons why a lot of the research has been conflicting over the years. All right, so we don't want to sonate an area more than twice the ERA, basically twice the size of the sound head. All right, so if we look at the diagram that I've drawn down here, the area of that circle is pi r squared, right? So radius squared. And so what that means is that if you look at those 2 circles, the smaller one is 1/2 the larger one. Okay, so but the radius only goes 5 to 7, doesn't go 5 to 10, and because that would give us a much larger diameter circle. So twice the area, looking at those circles, is only, that's about the size of what a sound head is. About a 10 centimeter sound head is what I tried to draw there. So we're looking at, about a 1.5 2 inch circle right there, right? So a pretty small area, and I pretty much challenge anyone to say that they insonate that small of an area each time they use ultrasound. Okay, so usually we're looking probably more like a 4 or 5 inch area as people circle that thing around. And so but our guideline is twice the sound size of the sound head. If you start straying outside that, you've got to increase your time. And this is what doesn't happen, is we don't automatically adjust our time for our increase in area. Okay, so very important point to think about as you start to do these types of treatments. Okay, and then that brings up our duration. So our 5 to 10 minutes for that area that's twice the size of the sound head, but you're going to extend that as you need it. If you turn down the intensity, you're going to increase your time. If you have a larger area than that twice the size of the sound head, you've got to increase your time. Unfortunately, this isn't done for us like it is for iontophoresis units, but you need to have some idea in mind about increasing that so you get the proper sort of temperature rise as you do your ultrasounds. Okay, so important considerations. Number of treatments, no real published studies here. Basically, if you're not getting some sort of progress in 2 to 3 treatments, 1 to 3 I listed there, but just a few treatments, if you don't see some change, you need to either discharge that, change the treatment, change the settings, do something different. Don't iron someone for 6 weeks and then say they were, nothing was working there. So check what you did. Okay, so clinical practice, you're usually seeing 3 times a week for both thermal level and non-thermal applications. Almost probably more based on how often people are coming to see us rather than real treatment efficacy. Sequence of treatment. Okay, so we always get asked the question, people will ice and then do ultrasound. Not the best idea. And I did pull the documentation up for this, but as you can imagine, we're trying to heat something. If we cool it down first, it's not going to get as hot. So, a little problematic there. And as well, you're also going to decrease the sensation, so you're increasing your risk at burn. So, probably not a good idea, even though you'll see this done in clinics, kind of old school technique. Okay, we already talked about applying during a stretch, which is a good idea because your window is pretty narrow after you've done your ultrasound treatment. Narrow after you've done your ultrasound treatment. Documentation, the CPT code is that 97035. Notice that it is a 15-minute increment. That doesn't necessarily mean that the ultrasound's on. You're setting that up, doing your treatment, but it does give you some latitude there, so you can extend that from that typical 8 or 10-minute treatment, right? So use that as you need it. You're going to document the area treated, and then everything, so someone else can come along behind you and do the same treatment. You want to be listing your frequency, intensity, duration, duty cycle, and your patient response. Okay, if you did something that wasn't standard, make sure you list that. The thing to keep in mind is just make your treatments repeatable when you write them down. Okay, and we're just going to finish with that last slide. Just going to put that out there for you so you have that for reference. Because it is just a nice slide showing you pretty much what you need to know for application of ultrasound. All right, well, we'll talk about, we'll go through the high points of this lecture in the coming days, and then head to lab and learn how to spin some ultrasound. All right.